What does a bladder ultrasound reveal about your bladder volume? Imagine a simple, painless test that can tell your doctor exactly how much urine is in your bladder right now. That's what a bladder ultrasound does. It uses sound waves to create real-time images of your bladder, allowing your healthcare provider to measure its size and shape without any invasive procedures. This measurement is called bladder volume, and it's a key piece of information in understanding how well your bladder is functioning. During the ultrasound, a small probe is placed on your lower abdomen. It sends sound waves into your body, which bounce back to create images of your bladder. From these images, the technician or doctor can calculate how much urine your bladder is holding at that moment. This is especially useful for assessing conditions like urinary retention, where the bladder doesn't empty properly, or for checking how much urine remains after you urinate, known as postvoid residual volume. Knowing this helps identify if your bladder is not emptying fully, which can be a sign of underlying issues such as nerve problems, obstructions, or even early signs of bladder health concerns. Ultrasound is also used to evaluate bladder capacity and how well your bladder stretches to hold urine. If the bladder wall is thickened or irregular, it might suggest the presence of tumors or other abnormalities. While ultrasound cannot confirm cancer itself, it can reveal suspicious areas that need further testing. For example, if a tumor or abnormal thickening is seen, your doctor might recommend additional tests like cystoscopy or biopsy. One of the biggest advantages of bladder ultrasound is its accuracy. Studies show that ultrasound measurements of bladder volume closely match those obtained through catheterization, which is more invasive. Ultrasound can reliably measure even small volumes of less than 100 milliliters, making it useful for detailed assessments. It is unaffected by factors like age, gender, or body mass index, making it a versatile tool in clinical practice. However, certain factors can influence the accuracy of ultrasound readings. For instance, the presence of fluid in the abdomen, known as ascites, can sometimes interfere with the images. Advanced ultrasound devices, including wearable or flexible patches, are being developed to provide continuous monitoring, which could improve management of urinary issues over time. In the context of bladder health and bladder cancer, ultrasound plays a vital role. It helps detect structural changes like tumors, wall thickening, or irregularities that might suggest malignancy. While it cannot definitively diagnose cancer, it guides further testing and helps monitor bladder conditions over time. In summary, a bladder ultrasound provides a safe, non-invasive way to measure how much urine your bladder contains at any given moment. It offers valuable insights into bladder function, helps detect abnormalities, and supports ongoing management of bladder health issues. If you're experiencing urinary symptoms or are at risk for bladder problems, talk to your healthcare provider about whether a bladder ultrasound might be helpful for you. Always seek personalized medical advice to understand your specific situation.